Good, you're good. So, more cable on this one. And who is this? This is you, I think. I'm not sure who that is. Just on one, this 2 inches. Check, check. 1, 2, 1, 2. Audio, audio. 1, 2, 3. You're good? 1, 2, 1, 2, 1, 2. Yes, no. You're good on audio? 1, 2. So am I. Check, check. How are you guys doing on audio? Are you good? Yeah. You're good on audio? Yes, kind of. Yeah. Cool. Better than before.
Welcome, everybody. Thank you so much for being here, and happy Public Health Week. On behalf of the County of Los Angeles Department of Public Health, I would like to thank all of you and welcome you to today's press event. We are so glad that you could be here with us today. To start off our press event with opening remarks, I would like to introduce our Director of Public Health, Dr. Barbara Ferrer. Dr. Barbara Ferrer is the nationally recognized director of the Los Angeles County Department of Public Health, which prevents disease and promotes health equity and well-being among more than 9.8 million county residents. She oversees a department of 4,600 dedicated staff. Dr. Ferrer has partnered with others for over 40 years to foster racial, social, and economic justice. She has been a public health leader, high school principal, philanthropic strategist, researcher, and community organizer. Please welcome Dr. Barbara Ferrer.
Thank you. Thank you so much, Stella, for that kind introduction. And welcome everyone to the University of Southern California's Health Science Campus. I do want to start by extending our deep appreciation to USC, Dr. Sarah Van Orman, and Minnie Ho for hosting today's event to kick off National Public Health Week, celebrate our heart heroes, and launch our latest preparedness initiative. More importantly, I want to appreciate the entire USC team for their partnership and their support over many years for so many public health initiatives. I do know that there's some dear friends of ours that are here today from the Keck School of Medicine. Dr. Howard Hugh is here. I think Dr. Meltzer is joining us. Dr. Shapiro is joining us. But I especially huge shout out to the faculty and students at USC who are joining us today. Our partnership with USC was critically important during the pandemic, and now will serve to guide us as we focus on ensuring that residents and communities have the resources that they need for good health. I also want to thank all of our other partners who are here with us today. And there's a fairly long list of impressive and committed leaders. So please bear with me because I'm going to absolutely make sure I acknowledge some of these amazing people. Dr. Calistinian is from the American Heart Association. I want to acknowledge Cash Hennessy and his parents. Cash is a survivor of a cardiac arrest. Kristen McGowan is here from the LA Dodgers. LA County Fire Chief Anthony Maroon. LA County Fire Chief Kristen Crowley. Ricky Tadeo, who's the director of the LA County Emergency Medical Services Agency. Jeff Howard, who's the administrative deputy from the Department of Public Works, and the Office of LA County Supervisor Hilda Solis is here, represented by Anthony Cespedes. Could we give them all a huge round of applause? And you're going to hear from some of these folks. I also want to note that we have representatives from the following LA City and County departments: LA Unified School District, LA City Emergency Management, LA City Fire Department, the Music Center, staff from the Department of Public Works, from the Department of Public Social Services, and of course, our wonderful Department of Public Health team members. Very importantly, we also have representatives from some of our dedicated community-based partners who have been helping us with all of this work on training folks, particularly on life-saving hands-only CPR. So I want to recognize the East LA Women's Center, Clinica Romero, and again, the American Heart Association, which we're all over this county in partnership with these efforts. One lesson that everybody learned during the pandemic is the importance of working together. When our communities are healthier, safer, and empowered to help each other, we flourish together. So as we embrace this week's National Public Health Week's theme, protecting, connecting, and thriving, we are all public health, we recognize the essential role of our partners and our residents in creating a public health system that works for everyone, everywhere. In celebration of our collective efforts to build thriving communities by advancing equity, increasing access to high-quality services and supports, and learning life-saving skills, we invite you to visit our website at publichealth.lacounty.gov/PHweek. Here you'll find a complete list of events, and you'll learn more about the amazing work that we're doing with our partners across the county. We do hope you'll be able to join us at some of the other events this week. Today, we're kicking off Public Health Week by recognizing the huge success of the 2023 Heart Heroes campaign, where we successfully trained 506,322 LA County residents in hands-only CPR in 9 months. Over 500,000 people were trained in over 9 months. That's right, 500,000 people, each one of them now prepared to save a family's life or to save the life of someone in their community. This would not have been possible without the more than 100 Heart Heroes partners that contributed to us surpassing our goal of 500,000 trained residents. I'm grateful that many of these Heart Hero partners and champions are here with us today, and I'd like them to all stand for a round of applause. Some of you stand. And there are people out there, put your hands up. Folks that didn't come up here. You're going to hear from some of the extraordinary partners in a minute. And though all of our partners couldn't be here, I do want to recognize outstanding efforts by the American Heart Association, the American Red Cross, LA Dodgers, the Kings, LAFC, LA Galaxy, LA County Fire, LA City Fire, LAPD, LA Convention Center, the Emergency Network, Los Angeles, USC, UCLA, Pepperdine, Rio Hondo College, University of Laverne, and LAUSD. I also want to thank the amazing team of public health nurses and other public health staff that joined our many partners to provide hands-only CPR training at hundreds and hundreds of community events throughout LA County. We were training at sporting events thanks to our sport team partnerships, parks after dark, music festivals, and events at the LA Convention Center. Also, staff in many of the county departments also had an opportunity to get trained. I'm also excited to announce today that the Department of Public Health is taking what we learned from Heart Heroes' Hands-Only CPR campaign, and we're launching a new initiative today. It's called the Community Readiness Champions. This initiative will include a series of in-person and online trainings for LA County residents to learn additional life-saving skills, skills that can be critical in the event of an emergency or a catastrophic happening. The aim of the Community Readiness Champions initiative is to offer residents across all of our communities an opportunity to learn skills that we know can save the lives of a loved one, a neighbor, or a work colleague. Community Readiness Champions will receive training that will equip them to respond to many emergency situations. These trainings are going to include hands-only CPR with an added component for automated external defibrillator awareness, AED awareness. With more than 350,000 cardiac events occurring outside a hospital every year, and many public locations, including shopping malls, school buildings, offices, sport facilities, and other places, having AEDs on site, we'll be incorporating AED training in the CPR training. So residents will be able to use an AED when they need one. Community readiness champions will also receive Stop the Bleed, a bleeding control training. A bleeding injury can happen anywhere. We've seen it happen too often on the news or in our everyday life. Life-threatening bleeding can happen to people injured in serious accidents or disasters. In fact, the #1 cause of preventable death after injury is bleeding. Instead of being a witness, we want to make sure that LA residents can learn how to stop the bleed with bleed control training. We're also offering community readiness champions overdose prevention training. Tragically, across the county and in LA County, deaths linked to opiates have spiked. As a matter of fact, we lose 7 to 9 residents every day from an overdose. Naloxone training and awareness will teach residents to recognize the signs of an opioid overdose and administer Narcan, a life-saving medication that can reverse an overdose from opioids. Community readiness champions will also be offered mental health first aid, a course that teaches individuals how to identify, understand, and respond to mental illness and substance use disorders. The training builds skills needed to reach out and provide initial help and support to someone who may be experiencing a mental health or substance use problem or experiencing a crisis. After our speaking program, everyone here today will have an opportunity to learn more about the Community Readiness Champions Initiative, and you can take advantage of the demonstrations and the trainings that are available today. We've all witnessed or heard about situations where the first person on the scene of an emergency were family members, colleagues, or even strangers. Since you never know when you're going to be called upon to be a first responder, we invite everyone across LA to take the opportunity to be prepared and learn skills that can help you save a life. We'll be hosting training events all around LA County this week and throughout the rest of the year. So if you know someone who could benefit from learning these life-saving skills, or you yourself would like to learn these life-saving skills, additional information and the schedule for the trainings is going to be on our website at publichealth.lacounty.gov/community readiness champions, /community readiness champions. Thank you once again for being part of today's celebration of Heart Heroes and our launch of the Community Readiness Champions. I will now turn it back to Stella, who will introduce just a few of our partners who were instrumental in our Heart Heroes campaign. I look forward to working with everyone, and again, a huge thanks to USC for graciously inviting us on their campus today. Thank you.
Thank you, Dr. Ferrer. Our next speaker is Dr. Sarah Van Orman. Dr. Van Orman is the Vice President and Chief Campus Health Officer here at the University of Southern California, where she is also a Chief of the Division of College Health and Clinical Professor of Family Medicine in the Keck School of Medicine of USC. Please welcome Dr. Sarah Van Orman.
Thank you so much. Good afternoon. It really is an honor to be able to welcome everyone here on behalf of the University of Southern California and Keck Medicine of USC. I feel so personally honored to share this stage with elected officials, colleagues from the Los Angeles County, the City of Los Angeles, the American Heart Association, the Cash family, and so many other key partners. I really want to thank them for all that they do for USC and our larger Los Angeles community. These types of collaborations and partnerships really highlight this year's theme, as Dr. Ferrer mentioned, protecting, connecting, thriving, we are all public health, and demonstrate how we can all come together to build a strong public health system. As I reflected on remarks for today, I really thought about how this aligns with USC's mission, which is to provide public leadership and public service in both our surrounding neighborhoods and the globe. Today's Public Health Week, as Dr. Farrar discussed, really celebrates our community readiness champions and highlights life-saving trainings that everyone can participate in. Hands-only CPR, naloxone administration to treat an opioid overdose, stop the bleed training, and mental health first aid. Here at USC, we see these very same issues in our own communities and our own campuses. How issues of heart disease, the opioid epidemic, mental health challenges impact so many of us. We also know that when individuals have knowledge, skills, and confidence, they can be an active bystander and they can save a life. This is why USC is so proud to support these efforts in the greater LA community and on our campus. This fall, USC departments came together to train over 2,000 members of our community, faculty, staff, and students in hands-only CPR. We now have over 100 trainers throughout USC who are bringing this to their coworkers, their classrooms, and their communities. Students across our campuses are spreading the word and increasing access to life-saving naloxone. I want today to especially highlight students from our own American Association of Psychiatric Pharmacists chapter, who have a table right behind me, who operated and create the Naloxone SC program. They have provided hundreds of units of naloxone and training to our campuses. Students, faculty, and staff across USC embrace their role in responding to a peer, colleague, or student in need and actively seek mental health training. More than 300 members of our faculty, staff, and students are part of our Campus Emergency Response Team, or CERT, who have life-saving skills such as stop the bleed and are ready to respond to emergencies on our campus and in their communities. This is why we're so excited to support the launch of these programs. We look forward to improving not only the readiness of our own faculty, staff, and students, but to support the work of the department to spread these skills through our community. It is also fitting, and I want to mention that we're having this event here on our Health Sciences campus. We are joined today by many health science students, future health sciences students, and the faculty who instruct them. We have students from our Chan Division of Occupational Sciences and Occupational Therapy, the Division of Physical Therapy and Biokinesiology, the Mann School of Pharmaceutical Science, and the Keck School of Medicine. As USC makes new advances at the frontiers of medicine, provides the most advanced clinical care, we know, however, that regardless of our discipline, improving public health, improving human health and well-being is grounded in strong public health. As leaders in health, we have unique responsibilities and opportunities. We can educate and inform our peers, families, and communities about these life-saving skills. We can be advocates for the value and role of public health. And here we're training the next generation of public health leaders who will make the next set of public health discoveries through research and innovation. I want to thank you for coming out today, for supporting and celebrating public health in action. And we're really delighted that USC can be a partner to public health. Thank you, and I'm going to turn it over next back to Stella.
Thank you. Okay, our next speaker is from the American Heart Association, Dr. Carolyn Kalustian. Dr. Kalustian is the Assistant Medical Director at the Keck Medicine of USC, specializing in concierge medicine, family medicine, geriatric medicine, and primary care. Dr. Kalustian is also a clinical associate professor of family medicine in the Keck School of Medicine of USC and a very dedicated member of the Board of Directors of the American Heart Association Board of Los Angeles. Please welcome Dr. Kalustian.
Thank you, Stella. And thank you all for being here. I have a shocking statistic for you. So 9 out of 10 people who suffer a cardiac arrest die. And this is unacceptable. And this is why we're here today. The American Heart Association launched the Nation of Lifesavers campaign. And our goal is to double the survival rate of those who experience a cardiac arrest by 2030. And thanks to the collaborative efforts of the LA Department of Public Health and the other organizations working with us, we've been able to, as we heard by Dr. Ferrer, to train over 500,000 people amongst us in our community. That's 500,000 people who are trained, not only trained, but ready to participate in life-saving. And that deserves a round of applause. And this is especially meaningful to me. I thought I had a little bit of bad luck. My mother, who graduated from USC Pharmacy School, in fact, went to become a physician after marrying my father. And unfortunately, before I finished my education, she suffered a cardiac arrest in our home when she was alone, not feeling well. And then why I say bad luck other than losing my mother is about 5 years later, my father-in-law, who I was living with, collapsed from a cardiac arrest next to me. And thanks to the training my husband received, his brother, and myself, our family came together and we participated in life-saving CPR. And now my kids have a grandfather who's helping me raise them, and it's invaluable. CPR is a critical skill, but more so, it's easy, especially when the adrenaline is pumping. But we have to be ready and trained in hands-only CPR when the time arrives, and also get over that hump to actually do it and include ourselves. And we're working to increase the survival rates in our community. With the continued efforts, I actually hope to see a future where every person who experiences a cardiac arrest, especially in my city, has a fighting chance to survive, because with effective CPR, it increases the chance for survival. Now I'd like to introduce you to a family whose story best illustrates the life-saving power of CPR. Please welcome Cash Hennessy and his parents, Brenda and Chad. Thank you.
Thank you guys for having us. My name's Brenda. This is Cash and my husband Chad. September 17, 2022. Cash was 13 years old playing football when he went into cardiac arrest. I did not know CPR. I did not know how to perform CPR. I was the first one to reach him. But we were so very lucky that there was 3 VA medics on the football field that administered CPR. The importance of CPR gave Cash the opportunity to not only make it to the hospital, but have 2 pliable options, which was open heart surgery and a heart transplant. We did not know that our son was born with a CHD, and it shocked us. Not only did we not know how to perform CPR, the site that we were playing on had an AED, but it did not have batteries. It is our mission to learn CPR. We have learned CPR, but to keep bringing this message forward. You never think someone as healthy as Cash, that had played football his whole life, would be in this position. Immediate CPR gave him the opportunity to make it to the hospital. He was airlifted. He was on ECMO for 7 days till they found what was wrong with him. He had open heart surgery. We were in the hospital for 33 days. And here he is, all thanks to CPR. So thank you all for all you do day in and day out. Even though you maybe don't have a family member, these are the faces that you can one day save, and he can now continue to have a great life And we just hope to pass this forward because those numbers are shocking. 9 out of 10 that do not make it is unacceptable. So thank you, everyone, for all you do. Thank you. Cash?
Yeah.
Okay.
I like to say that this could happen to anyone. Anyone could suffer from this, no matter who it is. And it's so important that everyone learn CPR because it could save so many lives and help out so many people. No matter who you are, it could happen. So everyone should know how to do it, and it could save lives. Yeah, so I was playing football and I came off the field because my chest was hurting. I couldn't breathe and I suffered a cardiac arrest. But my friend's parents came down from the stands and they were trained in CPR and they saved my life.
Thank you.
Thank you.
Many thanks to the Hennessy family so much for sharing your inspiring story with us. We're very grateful that you came with us today. All right, everybody, thank you. Our next speaker is Kristen McCowan, the Vice President of Government and Community Affairs for our very own Los Angeles Dodgers, 6-time winners of the World Series, most recently in 2020. Please welcome Kristen McCowan.
Hi, thank you, Stella. Thank you, everyone, for joining us here today. First and foremost, I want to extend my heartfelt congratulations to the Los Angeles County Department of Public Health for the successful conclusion of the Heart Heroes campaign. The Dodgers are honored to have been a part of this incredibly important campaign. More than 350,000 cardiac arrests happen outside of hospitals every year, with only around 20% surviving. But by simply administering hands-on CPR, the chances of survival double and triple. Studies have also shown that formal CPR training is less readily available in Black and Hispanic communities, and those communities are also less likely to receive bystander CPR. A campaign like Heart Heroes eliminates obstacles that often discourage people from seeking training and instead meets people where they are. The Dodgers were proud to participate in an initiative aimed at equipping our communities, especially those historically marginalized, with vital skills that could mean the difference in these critical situations. Heart Heroes had a goal of training more than 500,000 LA County residents, and as you heard from Dr. Stat in 2023. Through a united community effort, 500,000 plus individuals are now CPR trained in our community. And the Dodgers are incredibly proud to have hosted 31 of those public outreaches and trained 4,095 residents at our stadium alone. Hosting these events at Dodger Stadium truly demonstrated the spirit of camaraderie and unity fostered among our fans, coming together in a shared mission to protect and uplift one another. I want to reiterate how much the Dodgers value our relationship with the LA County Department of Public Health. We look forward to joining forces again on future campaigns dedicated to further uplifting our communities. Thank you.
Thank you, Kristen. Our next speaker is Los Angeles County Fire Chief Anthony Maroney, Fire Chief of one of the largest and most diverse fire departments in the world. Chief Maroney has been a member of the County of Los Angeles Fire Department for 38 years and a chief officer for the past 26 years. Prior to his appointment by the County of Los Angeles Board of Supervisors as the 10th Fire Chief and Forester and Fire Warden, Chief Maroney served as the interim fire chief. Please welcome Chief Maroney.
Just a little bit. Thank you, Stella. Before I begin my formal remarks, I just wanted to tag on to what Dr. Kalustian said about 9 out of 10 people dying We really need to do better to make Cash's story the norm and not the exception to the statistic. So good afternoon. I am County of Los Angeles Fire Chief Anthony Maroney, and I'm honored to join all of you today. I would like to extend my sincere appreciation to the County of Los Angeles Board of Supervisors for their unwavering dedication in providing quality services and resources to the residents they serve. Initiatives like Heart Heroes exemplify the continued collaboration between the county health agencies, public safety partners, community partners, and businesses to emphasize the importance of hands-only CPR. And a special thanks to Dr. Barbara Farrar for graciously inviting me to participate in today's event, marking the successful conclusion of the 2023 Heart Heroes campaign and the launch of the new Community Readiness Champions Initiative. Our collective efforts have not only raised awareness, but also implemented practical changes through the training of over 500,000 people in life-saving hands-only CPR. By achieving that ambitious goal set forth at the beginning of this campaign in 2023, we have taken significant steps to enhance awareness and preparedness within our communities. Last year, our LA County firefighters responded to more than 331,000 emergency medical calls for service, while our lifeguards on our beaches responded to over 12,000 medical calls. As firefighters and lifeguards, we are here to serve the public, and we do everything we can to help people when they need us the most. But the truth is, we cannot be possibly everywhere, every time when medical emergencies strike. That is why we encourage everyone to step up and be part of our emergency response team. We know all too well that sudden cardiac death can happen anytime and anywhere. More than 9 out of 10 people have the cardiac arrest happen at home. Unfortunately, even half of those who experience cardiac arrest at home will get the immediately help they need to survive before a first responder arrives. By knowing how to provide hands-only CPR, you can help save a loved one's life while firefighters and lifeguards are on their way. It takes only a few minutes to learn this life-saving skill, which can double, even triple, a person's chance of survival. In closing, today's collaboration between our many cooperative agencies is a testament to the county's dedication to fostering a community of individuals equipped to be heroes in the communities they live. We look forward to our ongoing partnership with LA County Public Health as we continue to train residents in hands-only CPR and launch the 2024 Community Readiness Champions Initiative. Thank you.
Thank you, Chief Maroney. Okay. All right. Our next speaker is Ricky Tadeo. Ricky Tadeo has over 30 years of experience in the field of emergency medical services. From 2010 to 2022, he served as one of the assistant directors for the Agency of the Emergency Medical Services for LA County and oversaw EMS programs. He was appointed as the director of the Emergency Medical Services Agency on March 31, 2022. Please welcome Ricky Tadeo.
Thank you, Stella. I will be brief. I'm Richard Tadeo. I'm the director for the Los Angeles County Emergency Medical Services Agency, and we represent the 88 cities and cover 33 fire departments providing EMS, as well as 70 hospitals that have emergency departments. We launched and collaborated with public health and honored to participate in Heart Heroes. We launched our Sidewalk CPR campaign in June, and we have our fire departments on our STEMI, and cardiac arrest centers participate. And on those 3 hours, we train over 3,000 bystanders on CPR. We have started monitoring our bystander CPR. We started all the responses of the EMS providers. You would be astounded by the number of close to 8,000 out-of-hospital cardiac arrests. And of those, only about 20% when we started, and through the last 5 years, we've only come up to about 40% of bystander CPR. Now, it is very, very important for folks to learn bystander CPR because the data shows that over 70% of our EMS responses for cardiac arrest, out-of-hospital cardiac arrest, is at home. So when I speak to lay people about their hesitancy about learning sidewalk CPR, the common response, or most of the response I get is basically, I am afraid of touching a stranger. But the responses, the 8,000 out of cardiac arrest that our EMS providers respond to, over 75% happen at home. So the likelihood that you would be performing CPR to save a friend, a family, or your child, or your relative is very, very high. So I will leave at that, and I'm, again, appreciative of being a part of the Heart Heroes. Thank you.
Thanks, Ricky. Our next speaker is LA City Fire Chief Kristen Crowley. Chief Crowley was confirmed as the 19th Fire Chief of the Los Angeles Fire Department, LAFD, on March 25th, 2022. She is a 29-year veteran as a first responder, with 24 of those years serving within LAFD. She has served on several boards, and this past year, Chief Crowley was nominated and confirmed to serve on the Homeland Security Advisory Council. Please welcome Chief Crowley.
Thank you, everyone. I think Chief Maroney got a little bit more applause than me, so just saying, just saying.
No way.
All right, good afternoon, everybody. I am extremely pleased to be here and super inspired to think about the work and efforts of the team that's here as well as behind me. What an incredible, incredible opportunity to highlight the incredible work that's happened. Now, another thing that has truly inspired me is looking at Cash. So Cash, come on up here for a minute. So we would lose out if we didn't take this opportunity, as I'm standing next to this young man who is here because individuals stepped up and did something. And with that, Cash is here. His mom and dad are sitting right next to him. And that is the power of individuals who step up to do something when somebody's in need. So Cash, I'm so glad that you are here. And you are an absolute inspiration to everybody out there, and this is our call to action to do something. Cash is here because somebody did something in your time of need. We're super proud of you being brave, and we're really, really ecstatic that you are here with us to tell your story. So thanks again to Cash. You're good, bud. Thanks. Hey, give me a fist bump. Boom. So with that, just a couple of brief remarks. We did talk about all the importance. You saw the statistics. You understand what these programs are all about. And we often say it takes a village. And it absolutely takes a village. If there's one takeaway that I can give you as your fire chief within the city of LA, and I'm so very proud and humbled of our 3,400 firefighters that get out there and do the job each and every day. Like Chief Maroney said, there's only so many first responders. Your firefighters are out there working hard for you. We need your help. So the call of action today is to take the courses, to get yourself out there. And I can tell you from my own experience of 29 years as a first responder, there's nothing more important where your heart can feel full when you know what to do in somebody's time of need. And that's what this training is all about. Over 500,000 people You are now heroes. You're heart heroes, and we are asking for the general public, individuals out there, to step on up, be ready, know what to do when somebody else needs you, and we need you just as much as you need us. So that's the call of action today. Again, super proud to be here with this incredible team, and let's keep showing up and let's learn hands-only CPR, everybody. Take care.
Thank you, Chief. Okay, next we have Jeff Howard from the Department of Public Works. Jeff Howard serves as the Administrative Deputy Director at the Public Works Department of Los Angeles County, overseeing human resources, budget, information technology, internal audit, and employee development programs. Jeff started with Public Works 23 years ago after working several years in the private sector as an industrial hygienist. Please welcome Jeff Howard.
Thank you. Good afternoon. I'm Jeff Howard, Administrative Deputy for LA County Public Works, and it's my honor today to represent our director, Mark Pastrella, in congratulating this team in achieving training of over 500,000 in hands-only CPR. Public Works is the nation's largest municipal public works agency. Our workforce includes over 3,600 employees spread about 500 job classifications, including professional, technical, clerical, and skilled trade positions. Although our headquarters is in Alhambra, we have personnel spread out over 70 locations in Los Angeles County. I want to thank Dr. Ferrer and her staff for spearheading this initiative and raising awareness in the county regarding the dangers of heart disease. Public Works was all in. Within just a few minutes of joining the campaign, we trained almost half of our workforce, which was a challenge, especially with them spread out over Los Angeles County. And we've already seen the benefits of this training. One of our employees likely saved a life. He was at an event on Veterans Day. A member of the audience was complaining of difficulty breathing. He overheard people asking if she was okay. She went into cardiac arrest, and he administered hands-only CPR. He continued with it until emergency medical services arrived, who resuscitated her, and his efforts likely contributed to saving her life. With just a few minutes of training, this training made a significant difference in at least one life. So I encourage employers all over Los Angeles County and all Los Angeles County residents to get trained in hands-only CPR. And again, I want to thank Dr. Ferrer and her staff for undertaking this initiative, and we were proud to be a part of it. Thank you.
No, it's okay. I appreciate it. Thank you. All right. Whoop. Got it? Thank you. Great, thanks. All right, everybody, thank you. Finally, I would like to introduce Anthony Cespedes. Anthony is the health deputy for our Los Angeles County Board of Supervisor, Hilda Solis, and he is here to recognize public health and the American Heart Association for the successful completion of the 2023 Heart Heroes campaign. Please welcome Mr. Cespedes, who will present the scrolls to Dr. Ferrer for Public Health and Dr. Kalustian for the American Heart Association. These are the scrolls. I'll just put them down.
Thank you, Stella, for that really warm introduction. And again, my name is Anthony Cespedes. I'm here today to speak on behalf of LA County Board Supervisor Hilda L. Solis, who represents the 1st District, which includes this beautiful campus here. I'm so glad to be here for the kickoff of National Public Health Week and to celebrate the work that DPH and the American Heart Association and everyone up here has done to train, the goal to train over 500,000 county residents in hands-only CPR. It's quite an accomplishment to train over 500,000 people in 1 year, and on behalf of the supervisor, I want to recognize and thank them for all their efforts. As we've heard, about 90% of the people who suffer from cardiac arrest outside the hospital will pass away, but studies have shown that bystander CPR can double or triple the chances of survival for someone experiencing cardiac arrest. This is an issue that is very near and dear to my heart, no pun intended. This Friday will mark 5 years to the day that my father passed away from cardiac arrest. And every time this event starts this time of year and we kick off the event and we start the hands-only CPR event, I sometimes wonder if what would have happened if my mom or my aunt had gotten this training needed and if the outcome may have been different. So I'm very grateful every time this year that this event kicks off because I know that it's going to save lives. We have proof of that here, and I really do encourage as many people to take part in it as possible, as I did last year, because I do think that it can make a significant difference in the lives of residents all over the county. So today I would like to recognize the extraordinary accomplishments of the 2023 Heart Heroes campaign and present 2 scrolls on behalf of my boss and the LA County Board of Supervisors. So the first, if Dr. Ferrer would join me up here, is to the Department of Public Health. And of course, I want to recognize Dr. Ferrer and all the incredible work she's done, not just in this campaign, but I always tell her that I've been the supervisor's health deputy for 3 years and advisor on matters related to public health, and it never ceases to astound me the amount of things that are underneath Dr. Ferrer's purview and the subject matter expertise she's developed on quite literally hundreds of subjects. So for this and for so many other things, Dr. Ferrer, thank you so much.
Great partner here. Thank you. It's super nice.
Can I hold it open? And of course, I would also like to extend our heartfelt gratitude to the Heart Hero partners. And I want to recognize the American Heart Association for their extraordinary contributions to the 2023 Heart Heroes campaign. So I'd like to present this scroll to Dr. Carolyn Kalustian of the American Heart Association. So again, on behalf of the supervisor, thank you to DPH, thank you to the American Heart Association, to everyone on this stage for all the incredible life-saving work you do. And please, everyone, I do implore you to take part in this important campaign. Thank you.
Okay, everybody, that concludes our press event. Thank you so much for being here. Please come and take the training.